If you struggle with obesity, you already know there's no easy or magic solution for weight loss. But the good news is, there is a proven medical solution. Weight loss surgery can not only help you achieve and maintain a healthy weight, it can alleviate many other conditions like depression, sleep apnea, diabetes, heart disease, and more. In this video, we're going to cover some of the basic information you need to know regarding weight loss surgery, including its many benefits, what to expect before surgery, the different procedures available, and what to expect during your recovery. Weight loss surgery can help you lose so much more than just weight. It can also alleviate or even eliminate many different life-threatening conditions. For example, diabetes, a condition that can lead to a host of other serious health problems, including blindness, kidney failure, heart failure, and amputations. Studies have shown that almost everyone who has weight loss surgery will see an improvement or complete remission of their diabetes, or high blood pressure, which is a major risk factor for both heart disease and stroke. Obesity is known to be a direct cause of high blood pressure, with 3 out of 4 cases being obesity-related. Weight loss surgery has been shown to reduce blood pressure levels to normal or near normal range. High cholesterol can also be alleviated by weight loss surgery, lowering your LDL levels and raising your HDL levels, which will further reduce your risk for heart disease. Like blood pressure levels, cholesterol levels can drop to normal or near normal range following weight loss surgery. Many patients who suffer from obesity also suffer from sleep apnea, causing them to stop breathing multiple times at night, waking them each time. Sleep apnea can lead to chronic sleep deprivation, high blood pressure, and heart disease. Weight loss surgery can significantly improve sleep apnea and can often eliminate the need for a CPAP machine. Unsurprisingly, weight loss surgery can also provide tremendous benefits for the health of your joints, reducing joint stress and improving arthritis pain. Weight loss surgery can even reduce your risk for cancer, including liver, kidney, pancreatic, prostate, and postmenopausal breast cancer, all of which carry an elevated risk in patients struggling with obesity. Those are a few of the specific conditions that can be alleviated by weight loss surgery, but it's worth noting that the positive results are worth so much more than just the sum of their parts. Significant weight loss can lead to significant quality of life improvements across the board, improving patients' self-esteem, emotional well-being, and general psychological state. Traveling, participating in activities with your family, playing with your children or grandchildren, everything can become easier and more pleasant following weight loss surgery. In order to ensure optimal success in your weight loss procedure, you'll need to undergo some preoperative tests and evaluations, plus make some changes to your diet. Here's what you can expect in the weeks leading up to your surgery. Many hospitals require you to attend an informational seminar to learn more about their program, as well as the risks and benefits of weight loss surgery. In addition to a complete medical history, your physician may require a complete physical examination to ensure you're in good health before undergoing the procedure. These will include blood tests and diagnostic screenings, as well as clearances from other specialists. You'll be asked to undergo a psychological evaluation to make sure you understand the responsibilities of life after bariatric surgery, and to ensure there are no issues that could interfere with long-term success. And finally, you'll meet with a registered dietitian who will discuss the particulars of the diet you'll need to begin prior to surgery. The dietitian will also do an evaluation to discuss eating habits and your support system, as well as to identify any roadblocks to making lifestyle changes. There are a variety of surgical options for weight loss. Some are restrictive procedures that reduce the size of your stomach so you feel full with less food, while other procedures change how your digestive system works so you absorb fewer calories. You and your doctor will discuss which bariatric surgery procedure is right for you and will produce the best results with the fewest risks. Here are the 3 most common surgical procedures. The gastric bypass procedure consists of 2 important steps: making your stomach smaller, which encourages you to eat less, and bypassing part of your small intestine, which reduces your absorption of certain nutrients. First, your stomach is divided into 2 pouches, one larger and one much smaller. The smaller pouch, which is approximately the size of a walnut, essentially becomes your new stomach. Since your new stomach can only hold about 1 ounce of food, you feel full much faster, and as a result, eat less. Next, your small intestine is connected to the small pouch, letting food enter your intestines directly from your new stomach and allowing your body to absorb fewer calories. The gastric bypass helps change your eating habits and how your body digests food, leading to a highly successful surgical weight loss solution. With this procedure, patients often lose 60 to 80% of excess body weight and will experience further hormonal changes that further contribute to weight loss. In a sleeve gastrectomy, more commonly known as simply a gastric sleeve, the surgeon begins by dividing your stomach into 2 parts, one larger and one much smaller. Once divided, approximately 75 to 80% of the stomach is removed, changing the structure of your stomach to be shaped like a tube, or sleeve. Thanks to the small size of your new stomach, you feel full much faster, encouraging you to eat far less than you did before. And since your stomach is a more streamlined shape, food travels through it faster, which allows your body to absorb fewer calories. The gastric sleeve encourages you to develop healthier eating habits and alters how your body processes that food, which makes it a highly successful solution for many patients. In the adjustable gastric banding procedure, also known as a lap band, an inflatable silicone band is positioned around the uppermost part of your stomach. When the band is inflated, it tightens around your stomach, creating a bottleneck that divides your stomach into 2 parts: a small upper pouch about the size of a golf ball and a larger lower portion. When you eat, the food goes first to the smaller pouch, which fills up quickly thanks to its small size, making you feel full and less hungry. Ultimately, this will encourage you to eat less and help you lose weight. Later, the band can be tightened or loosened as necessary to fine-tune the amount of food that can pass through the small opening to the lower stomach pouch. Unlike the gastric bypass or sleeve procedures, the gastric banding is also fully reversible if the need ever arises. Remember, not all of these procedures are available at all hospitals. Ultimately, your physician will help you decide which procedure is right for you. After your weight loss surgery, you'll need to stay in the hospital for a couple of days. Here's what you can expect in the days and weeks after your procedure. Immediately after surgery, patients usually receive fluids through an IV. After a day or 2, you'll be given liquids, such as broth or clear juice, to drink. However, your diet will progress based on your individual situation and your doctor's recommendations. Your doctor will recommend that you get up and begin walking as soon as possible. Walking as soon as you are able, even for short distances, is a very important part of post-operative recovery and is typical with many different types of surgeries. After surgery, one of the biggest changes you can expect is in your diet, both in the short and long term. For the first few weeks after surgery, depending on your doctor's recommendations, you will only eat pureed foods. After your surgery, it's vital to make sure you're eating adequate protein for healing and overall health. It's necessary to eat protein before other foods, especially early on in the post-surgery phase. You will start a vitamin regimen as soon as your doctor recommends it. Remember to have protein powder and protein supplements on hand when you get home. You may be advised to avoid lifting heavy items for about 4 to 6 weeks, depending on your doctor's instructions. Once you're able, you need to gradually and consistently increase your level of physical activity. Remember, it may take several weeks to return to your previous levels of stamina. Walking is a great way to get started, and movement after surgery helps reduce the risk of problems while you recover. Ask your doctor about how to build up to a more active exercise plan. Follow-up visits are usually scheduled for 2 weeks, 6 weeks, 6 months, and 1 year post-operatively, and then annually from that point on. It's important that you're in contact with not only your weight loss surgeon, but your primary care physician as well. Make sure they're partners in your care so they can adjust your medications after surgery when necessary. Are you ready to get back to the healthy, happy life you deserve? Find out if weight loss surgery could be the right solution for your life. Schedule a one-on-one consultation with us today to find out more about how weight loss surgery can help you lose the weight, keep it off, and take control of your future.